Hello, my name is Alexis Valenzuela. My topic to tell about today is polyhydramnios, Trasient, Antenataal, Bartter syndrome, and MAGED2 nutrition. Definition. Polyhydramnios is the excessive accumulation of amniotic fluid, the fluids that around the baby in the uterus during pregnancy. Trasient Antenataal Bartter syndrome referred to an impairment Bartter syndrome, a rare inherited defect in the thick accident limb of the lobe of Helen during pregnancy, but of this pathology can be caused by a mutation of the protein coded gene. MAGED2 melanoma antigen family D2. This mutation was seen in male offspring.
Fluid during pregnancy. Causes of polyhydramnios. 1. Fetal anomalies. Anencephaly. Esophageal atresia. Open spina bifida. Aneuploidy. 2. Placenta. Crea animal of placenta. 3. Multiple pregnancy. 4. Maternal. Diabetes. Cardiac or renal diseases. Sign and symptoms of polyhydramnios. Dyspnea. Palpitation. Edema of legs. Precocities in legs. Hemorrhoids. Evidence of preeclampsia. Treatment of polyhydramnios. Hospitalization. Postprandial blood glucoses test. Ultrasonography. Management of complications. Repeated amnioreduction, less than 37th week. Artificial rupture of membrane, more than 38th week. Polyhydramnios, causes, symptoms.
Application in medicine. The information collected from the investigation gave doctor additional information for possible cause. For the design mission, also doctor can now be prepared to treat of the heart, the baby, and the mother. By the time a mutation of the through a wallet exome sequencing of DME.
DNA rarely makes mistakes, but it can happen. A point mutation changes a single base. This can change the whole amino acid, or depending on its position, could go unnoticed. Other mutations can be more damaging. A deletion removes a base, but also causes a frame shift, which changes every amino acid after the mutation. Originally, the codons would be formed in this pattern. But after the deletion, the amino acid sequence will change because the bases shift by 1. The resulting protein will likely be non-functional. An insertion adds a base, but also causes a frame shift, which changes every amino acid after the mutation. Originally, the codons would be formed in this pattern. But after the insertion, the amino acid sequence will change because the bases shift by 1. Again, the resulting protein will likely be non-functional. Lastly, an inversion will invert a segment of DNA end to end. Watch this section closely. Each base has been moved around. Again, these mutations have the potential to be harmful, but not all mutations have an effect on protein. Remember, during translation, a start codon must first be read to begin coding the protein. If the mutation happens before or after the protein coding sequence, there will be no effect on the protein. Mutations must occur in the coding section of DNA to affect protein synthesis. Otherwise, nothing happens. Thanks for watching this episode of Teacher's Pet. Don't forget to like and subscribe and follow me on Twitter at SciencePet.
Ross account. The polyhydramnios caused by the mutation turn to males of it might go away on this one. The Antenataal Bartter syndrome is transient meaning in temporary. Transient meaning the isn't a treatment that fit gene mutation. Case can complicate later on to the death of the affected. Issue applied in Ecuador. In Ecuador, polyhydramnios is found in control down to pregnant women, and the MAGED2 mutation can be the cause of some decades. There isn't information about Bartter syndrome in Ecuador. It might be given to its rarity. But in other world countries, the car are treatment for case that present, this might not be the best.
Antenatal care is the care of pregnant women, and this is provided by trained healthcare professionals. And in Kuwait, it is done by the doctors and usually in hospital or in clinic settings. Antenatal care has to be individualized according to risk factors which are present in a woman. So it's different for different women. These risk factors can be as a result of the patient herself, which she may have some medical conditions like high blood pressure, diabetes, asthma, heart problems, or just vitamin deficiencies, or somebody may have infections like HIV or hepatitis. Some women, they may just be high risk because of obesity, that's overweight, and some women are high risk because they smoke. The others mainly as a result of their mental health problems such as depression. Sometimes these risk factors can happen as a result of particular pregnancy itself. For instance, she's got twins. For instance, this baby is growing too big. We call it large for gestational age, or the baby that's growing small, which is small for gestational age. And this can also happen as a result of, for instance, the fluid around the baby is too much, or fluid around the baby is less, or when her membranes rupture before time, and as a result of diabetes developing in pregnancy, or preeclampsia or antepartum hemorrhage. These risk factors can also happen as a result of previous pregnancy history. Previous pregnancy problems can also put a woman in the high risk category. Family history of congenital abnormalities. So this is another one. A family history of genetic disorders. So they can all make a woman high risk. High risk or low risk, we do not know sometimes until the pregnancy is over. So that's why we have to follow up every woman and provide antenatal care, which is high quality. It's variable. Like I said, some women are high risk, some women are low risk. So as we follow on, we need a first booking visit, and follow-up visits are tailored according to what the needs of a woman. Gestational diabetics, we need to really see them almost every 2 weeks because they need to be closely monitored. We need to make sure their blood sugars are normal. Same with those women who develop preeclampsia. We sometimes have to see them once a week, twice a week, because it's to make sure that the blood pressure is under control. So it all depends on how the progress of pregnancy is.
The conclusion. This was some information about the mutation of the MAGED2 gene is important to consider so doctor can get a good, complete diagnosis and also give the best care during the pregnancy. As it a gene mutation, there isn't a treatment for the MGD2, but what can be treatment is the polyhydramnios and the effect produced in the Bartter syndrome. Also, these designs aren't normally dangerous or alert. Thank you.